It's another day of unrelenting demand in the emergency department of Birmingham's Queen Elizabeth Hospital.
Is there any movement in terms of beds?
Patients are lining up on trolleys in the corridor, and the waiting room is packed.
Customer, counter 1, please.
She's taken an overdose of some prescribed medication.
The psychiatric team based in the department is dealing with a number of people who've tried to take their own lives.
She had a follow-on plan. She had taken an overdose the last time.
Among them, a woman in her early 20s. Doctors have dealt with the physical effects of the overdose, but the root cause is her history of mental health problems.
So what's happened? I mean, what's brought you into A&E today?
I took an overdose. I went up to the train track.
She is one of a rapidly increasing number of patients arriving at A&Es like this with psychiatric difficulties. Many are young.
The voices are getting more intense, wanting to harm myself. It's not attempts, it's actually trying to do it, not just doing it as a cry for help.
Is this the worst that you've ever felt?
I've never been this bad before. I'm scared.
In a busy A&E, even finding a room for this conversation was a struggle. Now this isn't the right place for her, but she needs to be monitored.
It actually has suicide intent, you know, although if we were to discharge her from here, she would likely kind of like go out there and try and do something even riskier.
Was there any particular trigger why you took the tablets?
At this hospital, they see more than 100 people a week facing a psychiatric crisis. And the Mental Health Trust has set up a quiet unit nearby to assess people away from the pressure. Its staff then search for the psychiatric beds or community support needed.
OK, we need to admit this lady. I'm trying to act upon this as a matter of urgency for this lad because he doesn't sound well at all. Nobody in a mental health crisis should be in accident and emergency unless they've got a physical health need. Our A&Es, what I see, they are very, very busy, overstimulated places, you know, and somebody in the mental health, with a mental health issue, it's just not conducive at all to them to be in that environment.
That's why in Birmingham they've set up this street triage team to intervene before people reach the emergency department.
Patient hearing voices stating going to kill someone.
With a police officer, paramedic and psychiatric nurse on board, they respond to 999 calls where there are mental health concerns.
I'm a nurse, my name's Lisa, okay, and we're the triage team.
Already this evening, the man they're visiting has called for an ambulance several times. His physical health is checked, they listen to and assess him.
You were telling me that there was these negative voices in your head at the moment.
I think like there's someone controlling me. It's kind of like I'm some kind of machine.
After half an hour, it's agreed rather than going to A&E, he'll keep a community appointment in the morning. Has it helped, having the visit?
I think the first step is me asking for help, as well as being assured that I will get the help.
Over the last 4 or 5 weeks, he's been going to A&E quite a lot. I think he's had 6 admissions through A&E. So we've come out tonight to try and prevent that cycle.
Night and day, the street triage team is in demand. But here they believe it's making a difference in getting people the right help.
We managed to reduce the numbers of attendants to the A&E, but what you get high quality. You get mental health, police forces and paramedics working in collaboration together to look after one single patient.
For many, A&E will remain the first place they turn to. The challenge is to help people who are vulnerable before they reach a crisis.